So good morning, everyone. Thank you for joining us for the third webinar in our webinar series on COVID-19 management, trying to deal with the new permanent standard and learn some about what the compliance requirements are by the March 26th, 2021 deadline. Today, we're going to have a roundtable and some questions answered. My name is Dean Young. I'm the Vice President of Industrial Development, for those of you who are now familiar with me in the series. I don't know if there's anyone new in here, so I'm going to cover this relatively quickly so that we can get to the content that you really are here to get. But for those who aren't familiar with Gen Edge, if this is your first time interacting with us, we are a political subdivision of the Commonwealth, an economic development entity focused on helping manufacturing, engineering, and technology businesses innovate, compete, and grow. We're affiliated with a federal program called the Manufacturing Extension Partnership Program, or MEP network, and we have been since we started operations in 1994. And that allows us to have some broad reach in terms of helping provide some management and technology consulting help to those companies at a really reasonable cost. And that's really what we're trying to do, is to help those companies compete. We're based out of Martinsville. We've got 30 direct employees, but we also employ an extensive network of third-party providers, most of them small businesses in the Commonwealth. So that's generally how we deliver help to companies. We are regionally focused, so we have regional managers aligned with the different regions of the state, but then we try to bring those services. So we have kind of a national reach in terms of service development and delivery, but a local touch in terms of our ability to interact with companies and understand their needs on the ground. I'm going to turn it over to our practice manager for organizational development, who is really the brains of this operation here, April Schmidt. So I'd like to introduce April. April joined us recently from the Missouri enterprise, which is part of the Manufacturing Extension Partnership, and has really helped us up our game when it comes to some of the delivery we're doing. And this series is a great help, I think, to the manufacturers in the state. So April, I'll let you take it away from there.
Good morning, everybody. Thank you so much for joining us again for part 3 of this webinar series. A couple of burning questions I'm sure you guys have is, will you get a copy of this recording and the slides? Absolutely. We will send those out to you most likely later this afternoon or early tomorrow. Please do check your junk folder if you don't see it in your inbox, because sometimes our emails may not make it through your spam filter. If you have questions, please use the chat feature down at the bottom. Or if we get through the slide presentation, you feel more comfortable unmuting yourself and asking that question to Stephen and Hunter directly, please feel free to do that. If you have ideas for a great topic or webinar, I will put my email in the chat so that you can get in touch with me and let me know how we can support you. We will also do a very short poll. It will take you 60 seconds or less to be able to provide us feedback on today's webinar. And with those housekeeping items out of the way, I want to introduce Hunter Burns and Stephen Gould, who are our presenters today. They are located in Danville, Virginia, and they have over 30 years of combined and diverse legal experience and multi-jurisdictional experience. They focus on business and corporate law, employment law, litigation, counseling, training, analysis, and they have provided tremendous amount of knowledge for us in understanding this new permanent standard as it relates to COVID-19. And with that, I will turn it over to Hunter and Stephen.
Thank you, April. I am Hunter Burns, and this is Stephen Gould next to me. And we've really enjoyed these webinars so far, and we're really appreciative of the questions that have been sent in already. And as April said, if you haven't sent any questions in yet, it is okay. You can hold yours until later on when we will open it up, and we're going to get in rather quickly to the actual questions that you have today. Before doing so, Stephen's sharing his screen now. April already mentioned that we're located here in Danville, Virginia, and we focus primarily on businesses and their needs, a lot of consulting and policy drafting, commercial litigation, employment law, and administrative law. So we have spent a lot of time over the past year getting to know all the regulations and effects of the pandemic on businesses and employment matters. So A lot of what we're talking about today and last week are not new topics to us, and unfortunately, they've changed quite a bit since the beginning in terms of how our governments, federally and on a state level, have responded to the pandemic. So we always begin with a disclaimer. If you've already been on, we forgive you for shoving Saul Goodman down your throats every single time. But it's important that you understand we're here trying to give you some information, but you are not clients of ours. This should not constitute legal advice to you specifically. And if you have further issues or needs, then you should consult with your own attorney or contact us directly, and then we will actually begin an attorney-client relationship. So moving on, today we're going to have a quick recap of what we handled last Thursday. And that is rapid testing of your workforce and vaccination policies. And then we will move quickly into the questions that have already been submitted and our answers. And then we'll open it up for any other questions for today. So beginning with last Thursday's webinar, rapid testing. We explained that the EEOC allows testing of employees so long as the testing is in a non-discriminatory and job-related fashion, and the testing is deemed accurate and reliable. You need to keep in mind that there will be costs that may be borne by the employer, and it might be shared on a federal or state level, but you always need to factor in the time and expense that it will cost you as an employer to do testing on a widespread basis. Any testing that is required must be borne by, it must not be borne by the employee. So if you're not getting any aid from the governments, then it is going to be fully funded by the employer. And you must allow eligible opt-outs under the Americans with Disabilities Act, under Title VII, which includes religious beliefs and other protected classes. And finally, that you absolutely must keep the results confidential. You cannot release specific information about specific employees. You can release results such as we had 10 positive test results, but you cannot release the information about specific employees. We recommend highly that you consult with GenEdge, use their COVID resources to your advantage. They have done a really good job of providing a lot of resources there for your use. And if you're considering handling the testing internally, they've done a lot of good work already on the matter, and you can save yourself a lot of time and headaches by just consulting with GenEdge. So vaccinations, it is a very hot topic and has been since really since January of this year, as the vaccinations really started rolling out. Obviously, one of the biggest issues is the availability of those vaccinations. When you're considering mandatory policies, you need to first and foremost make sure that the vaccination is available. If you're going to mandate it, it doesn't make sense if all of your employees can't actually get the vaccine yet. So it depends what class they're in, and for most of the folks on this call in manufacturing, you're not in the healthcare industry or the frontline worker industry, so a lot of your employees are not in the list of candidates right now. They're on the priority basis. So Again, with the vaccinations, the cost cannot be borne by the employee if you're mandating. And quite frankly, most people don't have to pay for the vaccination anyway. The requirement is that you not require the employee to pay anything. You must also allow eligible opt-outs, just like we were talking about for testing. The EEOC again has specifically said you may mandate vaccinations if they're available, but you have to give the opt-outs for ADA Title VII. That again, it's all based upon discrimination. So you want to make sure that you steer far and wide from that. One of the biggest issues that we talked about last Thursday that we've seen from a lot of our clients is the concern about the detrimental effect on morale that a mandated policy might bring. You need to be able to assess the need for your employee workforce to all be vaccinated, and if you think that that's necessary, what is going to be the effect of morale on your workforce? Are you going to lose people? Are they going to start calling in sick when they're not sick, et cetera? Once the vaccine is actually available to all, then you might want to look at the mandatory policy. It's basically academic at this point in time. One of the final questions that we received the most from employers is, what's the liability we carry by making people get the vaccine? If there's a problem with the vaccine, are we going to be liable? And the true and safe answer for us is, well, that's unknown at this point because there's no legislation related to it, and there aren't any court cases related to somebody suing for a reaction that they received from the vaccine that was mandated by their employer. So we don't know for a fact, but it should be covered under workers' compensation. If the employer is liable at all, it would be through workers' compensation. And from a practical aspect, we don't expect that employers will be held liable for trying to protect their workforce and a third-party agent producing something that perhaps had a side effect. So that's basically where we are at this point. So we're recommending employers go with optional policies unless they're in healthcare at this point, because we know that the healthcare had the option of getting the vaccine. The healthcare workers did. So that's about it for that slide.
All right, now we'll move into answering the questions that you all have submitted over the last week, and again, we appreciate the thoughtful approach that everyone's taken to submitting these. Just a couple of quick items as we begin to jump into these. We have worked to kind of standardize the questions as we can. Obviously, they were submitted by lots of different folks, so we've tried to get them in similar formats. We have tweaked the wording of the questions as necessary, just to help streamline them and make them as generalized as possible. And kind of consistent with our Saul Goodman disclaimer earlier, these are intended to be general feedback, and just a reminder that the application of these answers to your business may not take into consideration some specific facts or nuances that are particular to your operation. So you may want to talk with your HR team, with your legal counsel, to make sure that everything that is specific to your employees and your operation is taken into account here. Going to start with question number one, and it's basically this: if you are using temp employees from the staffing agency, who has to make sure that those folks are trained. Is it the staffing agency or is it you? And the answer there is going to be both. But for your purposes, you as the employer of employees who are temps who are coming from staffing agencies, you have the responsibility to make sure that those folks are trained. Under the permanent standard, employee has been explicitly included, or temporary employees have been explicitly included in the definition of employee. So as a result, when it comes to the training that you are carrying out, you should not recognize any distinction between your regular employees and temp employees.
And just for those who are not on last Tuesday, the permanent standard that we're referencing here is the Virginia permanent standard relating to COVID management. And we went in depth with a lot of portions of the permanent standard, the most applicable to everybody that was on the webinar. So the training that we're talking about is COVID-19 management training, things such as proper spacing and PPE use and things of that nature. So if you see anything referred to as the permanent standard, that's what we're talking about.
Excellent. Thank you for mentioning that. And one other thing I would add with respect to our answer to this question number one is that even if temporary employees had not been included in the definition of employee here, our advice would be to cast a wide net. And so truly, if you have a question about should this person be considered an employee and trained, we would recommend, yes, train more people rather than less people, because the goal here is keeping everyone safe and allowing your business to remain operational with as few disruptions as possible. So, and again, that approach is also consistent with the general thrust of this standard, which is to protect as many people as possible. So the takeaway there is whether they are your employee or an employee coming from a staffing agency, you need to make sure that they are trained consistent with what you expect. All right, moving into question number two. This one dealt with spacing and masks. The question was, if employees are spaced 6 feet apart and have barriers between them, are masks still going to be required under the permanent standard? So for those employers who have medium risk levels for their employees, no, the masks are not going to be required so long as the employees are not interacting with the public or they're not with one another from a closer distance. That said, if they are interacting with the public, or if they're coming within 6 feet of one another, they should wear a mask. And from a practical standpoint, we would recommend having a requirement that if folks leave their workstation, whether that's a desk, a cubicle, an office, a spot on an assembly line or on a factory floor, if you are leaving your spot, and by doing so, the odds of you coming into close proximity with another employee increase, even if just a little bit, you should wear your mask. So that is something that, again, just to make sure that everyone is protected to the greatest extent possible, we would recommend doing that. Also, consider whether the barriers that are in question are providing meaningful separation. This is something where I think back to just guidance that my mother would give me as a child if I might try to come up with a creative solution, and whether it was her telling me that was too cute by half, or that it doesn't pass the smell test. Again, you just want to be making sure that you're taking a thoughtful approach here, and that the protections that you've put in place are truly done in good faith. So, making sure that, yes, you are at 6 feet or hopefully more in terms of the distance between employees, or that the barrier that you've put in place does provide meaningful separation. Those are things that again, you want to make sure that you're not being, you're not trying to be too cute and do the bare minimum. You want to do as much as you can here to protect your team members.
We've gotten a number of questions about close contact and the fact that close contact is, the definition has changed over the past year to within 6 feet of somebody for 15 minutes or more. And so, you know, when people were very cautious at the beginning in terms of, well, we need to have people wearing masks whenever they're coming anywhere close to somebody else, they wanted to get away from that. And our recommendation, just along the lines of what Stephen was just saying, is better safe than sorry. If you think you might walk by somebody on the way to the restroom, you know, you should have a mask on before you see the person walking by you. You know, you shouldn't carry the mask, just put it on your face as if you're going to leave your station.
And I think a helpful comparison may be the rule at the gym that Hunter and I go to, which is if you're on the treadmill and you're actively working out and you're distanced from other folks because they've got the machine spread out, you're fine without a mask. But if you're coming into the building, if you're walking from one machine to another, if you're walking to the cleaning station to get the sanitizer and the paper towel to wipe down the treadmill and coming back, in those situations, wear your mask. So that is just a good kind of clean, easy to administer rule there. All right, we'll move on to question 3. And Hunter, is this you or is this me? That's me. And then I'll turn it over. So question 3 is, under the permanent standard, is a single-use disposable mask, and here the question defined that as a mask made up of multiple layers of non-woven fabric and melt-blown layers. Is that still an acceptable form of face covering? And our answer here is yes, most likely. And honestly, as it's described, this would probably qualify as a surgical or medical procedure mask, which is going to be one step up from the face covering definition, which is kind of the floor, so to speak. So you've got face covering, and then above that, a surgical or medical procedure mask, and then the top level would be the respirator. So to the extent that face coverings are going to be required, this type of mask, as it's described, we believe will meet the definition. And I would anticipate that there may be some additional practical guidance coming out from the Virginia Department of Labor and Industry down the line. You know, one thing here is that I would say not only trying to make sure that you are that folks are wearing the appropriate type of mask, but the main thing here, and what the Department of Labor and Industry at a minimum is going to be looking for, is just making sure that folks are wearing some type of mask. There may be questions about which category a particular type of mask falls into, but making sure that someone is wearing a face covering when they need to, wearing a face covering and wearing something that fits appropriately over the nose and over the mouth, which is explicitly required for face coverings under this permanent standard. Just making sure they're wearing something, it fits, that it's not flimsy. We all know at this point what an appropriate face covering looks like, and the things that somebody might try to fashion at Walmart so that somebody doesn't say something to them, that may not meet the standard here. But you know, as long as folks are wearing something that looks appropriate, you know, that is a step in the right direction.
And just to add on, if there's any question about face shields, that's not the same thing as a face mask. And it's specifically called out that does not count. You can put that on over the face mask, but the face shield by itself does not meet the requirement for the face mask, because, as Stephen mentioned, it needs to cover the nose and the mouth whereas a face shield does not contain it. It prevents a spitting or the mist or anything else from coming out, but the face shield does not do it by itself.
And there is an exception that allows face shields in lieu of face coverings if someone has a health reason that would prevent them from being able to wear a face covering. But generally the face shield, like Hunter said exactly, is not going to be an appropriate substitute. All right, we'll move on into question 4 now.
Well, sticking with PPE, for those that might not have been around for the first one, you know, we talked a good bit about PPP, which is something completely different, and this is all personal protective equipment. I realize in COVID world, probably everybody knows what PPE is, but nonetheless, the question was, have masks, specifically the N95 mask, been causing respiratory problems? If an employee wears an employer-provided mask and develops respiratory issues that they did not have, that did not exist previously, because of use of the mask, is the employer liable? And the question is, the answer is yes and possibly. The answer to the first part, which is have masks, specifically the N95 mask, been causing respiratory problems? The answer to that one is yes. And the answer to the liability is possibly. And basically what has been found is that the N95 masks, although they might be more effective than most face coverings, can reduce oxygen intake. So that can cause respiratory problems. These masks are not required in most cases, except in very high and high risk situations, or if employees are traveling in the same vehicle. The N95 masks are not actually required anyway. So if somebody is wearing those, or the company is providing the more expensive N95 mask for all employees, it's not required. And in many cases might not be advisable, simply because it does reduce the ability to breathe. So liability, however, remains an unanswered question. It's much like what I mentioned earlier. And the answer is kind of similar to what liability does an employer have for a mandated vaccination or something along those lines. The expectation is that if there are any claims and there is any liability, it would fall under the workers' compensation framework, because it was while they were at work and as a result of work requirements. But it's really an unknown world at this point in time. Okay. Question number 5. This relates back to whether or not you can have testing required for the job. As part of that answer, the answer was yes, an employer can require testing so long as it is, quote, job related. And the question is, what is the definition of job related in reference to being able to do the testing? Well, that's a pretty good question.
Very good question.
It's one of those things where we gave the answer, and somebody said, well, yeah, but you know, what if I don't think job related is what they think job related is? So good question. COVID tests are allowed if they are 1, job related, and 2, consistent with business necessity. So, you know, 2 prongs here. The first one being the job related. Now, job related, what it means is if there is a reliable COVID test, you're going to be okay if it is necessary for you to exclude employees if they would pose a direct threat to the safety or health of others. So if you're testing because you want to make sure that that person in the workforce is not going to either get somebody else sick or get sick on the workforce while at work, then that's job related. If you've got, what would not be job related is if you required somebody that was working remotely by themselves to get tested because they're not a direct threat to anybody and nobody else is a direct threat to that person. So that's not job related. You'd just be doing it because you want to say that your workforce is 100% COVID free. That's not job related. That's just you wanting to run up a stat. So, and the next possible question would be, you know, is it really a direct threat? Well, if you're following any guidance from the CDC, DOLE, Virginia Department of Health related to COVID, then that is going to be sufficient to classify as a direct threat. That's really not the question that was posed and really not ever going to be in doubt during these times anyway. COVID is a direct threat. I think even those who don't think it's as bad as others do would at least admit it is a direct threat to an employer. And so that's the answer to that.
So an employee's aunt or uncle saying on Facebook that something is not a direct threat is not going to be sufficient to make this job unrelated.
Yeah. Luckily, Department of Health and CDC have a little more credence in the court systems than Bubba. And nothing against Bubba's. I'm from Tennessee originally, and I knew lots of Bubba's. So the next question is fairly administering policy for requiring tests. The question is, if an employee shows signs of COVID, our company has required him or her to get tested and paid him or her until the results come back. Can we still do this under the permanent standard? The answer is yes. And it really should be absolutely yes. I think this is exactly what Virginia wants you to do. Neither the permanent standard nor any other Virginia law limits an employer's ability to pay individuals who are awaiting testing. And that's a very broad statement, but it is a very accurate statement. So long as the employee is being paid, nothing adverse is happening to that employee. So that employee really wouldn't have any claim, any foundation of a claim to assert against the company. If they got paid for doing nothing, you're going to be good. If an employee is getting tested at your direction, you should be paying for the time spent getting tested. So if you send them over to an offsite facility to get tested, the time that it takes that employee to get to that facility and back, and that they spent at the facility should all be paid, because you're requiring that as part of their employment. And as anybody who's had any issues with the Fair Labor Standards Act knows, you're supposed to be paying your employees for doing anything that you direct them to do. Even if it's pick up something on your way to work, well, they're actually working then on their way to work because you told them to do it. So as with other COVID related policies, you need to be extremely consistent with your application to all of your employees to make sure that you're being fair. So ask yourself, does this policy disproportionately affect, even if it is unintended, a particular subset of your employees? Because that's when you could possibly get a claim for discrimination, that you're treating some employees differently than others, even if you didn't even think of it. So ask yourself in advance, could this possibly have those implications? And a final reminder on this point: if someone is known or suspected to be infected, employers can only use the symptoms-based assessment for allowing him or her to return to work. The reason we throw that reminder in at this point is because we're talking about testing your employees, keeping them out until the test results come back or whatever. That's a completely different question than if somebody has tested positive and they want to return to work. Do I have to send them for testing and so on and so forth? The return to work is based on a symptoms-based assessment. So we just wanted to clarify that at this point, even though it's not directly responsive to this question.
And just one thing to add about the consistent application of policies in terms of whether there may be a disproportionate effect. If you are, let's say, distinguishing between different groups of employees in terms of paying some folks to stay out until results come back, but not paying others. If the group that is, let's say, not being paid consists of all women, all men, all members of a certain religious group, everybody is a certain color. If there is a way that even if you are using a neutral distinguishing factor, as in you're in you have this job set or these job duties and this is your position, and these other folks have something different, and we're going to distinguish based on that. Even if you think you're doing everything above board, as Hunter said, if unintentionally the folks that you are excluding from receiving a certain benefit happen to all have something in common, you could be walking into a potential discrimination claim, or at least having to deal with that before a court might throw it out. So just always something good to keep in mind, to say, okay, practically speaking, what is the result of this? And are there folks who could be who could have a legitimate grievance, even if it's not coming from a bad place on my end. All right, last two questions, and then we'll open it up to for any real-time questions that folks have. And this relates to maintaining the privacy of your employees who are either testing positive or fear that they may test positive, maintaining their privacy while you're notifying others. The question was this: with contact tracing not being required, which is the case under the permanent standard, and recognizing the need to maintain the privacy of someone who is symptomatic but doesn't yet have a confirmed case, basically, what can we as employers do? Specifically, can we make a generic announcement that there is a positive or potentially positive case, tell people when that employee last worked, and ask others to be on the lookout for symptoms? And the answer is yes. But we would recommend waiting until there is a confirmed positive case before you make an announcement, as long as you are using other required safety protocols. So again, as long as folks are doing what they should in terms of keeping distance, wearing masks, doing other things, until you have a confirmed positive case, we would hold off on saying too much. And practically speaking here, there really should not be much lag time between someone being symptomatic and getting a test result, because the availability of testing is sufficiently widespread, even in less populated areas, that you're not asking or you're not really going to be waiting for hopefully more than a few hours before you find out something. A couple of considerations that we would encourage you to keep in mind. One is the size of your workforce and whether privacy is actually protected by what you are announcing. There's certainly a difference between a facility that has 100 employees and one that has 5 or 6, and one employee happens to be out on the day that you're making an announcement. If there is, hopefully there will be a little bit of mystery as to who this may apply to. So just keep in mind that while we understand that you want to encourage folks, you want to be above board with folks be transparent, let them know if there has been a positive case. There are circumstances where doing so could unintentionally identify the person who has tested positive when you don't want to do that. And last thing we want to mention here is that the symptoms-based assessment is just for purposes of returning to work. So we were talking about being symptomatic earlier, but that is different from the determination of the return to work assessment, which is based on symptoms rather than testing. All right, our final question that we've got a formal answer or a formal written answer here, it deals with the reporting requirement for the Department of Health that exists in the permanent standard. And here's the question. If you have an employee who does not get a test to confirm that they've got COVID, but they've basically got enough symptoms that are consistent with COVID to make you think this person has COVID, even if I don't have confirmation of that, are you going to need to report that to the Department of Health? And the answer is no, that reporting here is not required. Under the permanent standard, the requirement to make a report to the Department of Health is when your work site has 2 or more positive cases within a 14-day period involving employees who have been present at that work site during the period. Now, there is nothing that is going to prevent you as an employer from sharing concerns with the Department of Health. So even if you think that someone has showing all the telltale signs of having COVID, but they don't, and you send them home, but they don't actually get tested, there's nothing that prevents you from sharing with the Department of Health that you have some concerns about possible exposure for other folks on your team. However, I think we should all keep in mind that the Department of Health's ability to respond could easily be limited right now based on the prevalence of confirmed cases. I think most of you, if you have interacted with your local Department of Health, know that they are just at maximum capacity, or maximum capacity is in the rearview mirror, and they're just doing the best job that they can. And the confirmed cases are going to be the priority in terms of what they're focused on, rather than potential cases where there isn't confirmation. And if you do reach out to the Department of Health in these circumstances, they're likely going to encourage you to have that implicated employee quarantined for 10 or 14 days. Again, that's going to be consistent with what the permanent standard is requiring. One thing that we did want to mention here, this is something that has remained consistent across or between the temporary standard and the permanent standard, and which we didn't focus on in our first presentation, but it remains a requirement. So not just reporting to the Department of Health, but employers also need to report it to the Department of Labor when they have 3 or more positive cases during the same time period that we mentioned above. So if you are reporting something to the Department of Health, if that trigger has been satisfied, you're going to want to remember to also respond to or report that to the Department of Labor and Industry at the same time. A couple of recommendations and takeaways before we jump into any other questions that may exist. And really these fall into the category of practical guidance for employers. First and foremost, as an employer, we encourage you to err on the side of caution. Train everyone who is on your property or on one of your work sites. Do not shy away from requiring that masks be worn, even if the permanent standard is not going to hold you to that. You want to take care of your people. You want to do everything you can that makes sense to limit disruptions to operation and limit any potential exposure for your employees. And at this point, most folks are comfortable with wearing masks and they understand why they're doing it. And when in doubt, there's nothing that's going to prevent you from taking more extensive precautions rather than leaving something to chance. Again, you want to take care of your folks. Everybody understands why you're doing what you're doing. It's not to say that you won't have some pushback from folks on your team, but most people typically understand and appreciate that you're doing these things to protect them. And finally, here we would encourage you to continue to screen your employees, to question them about symptoms, to test them to the extent you're doing that. But again, continue to recognize that there are exceptions that will limit you from doing that in certain circumstances. Nothing prevents you as an employer from being more generous to your employees than the law requires. That gets back to what Hunter was talking about earlier. And again, nothing prevents you from reporting any concerns or positive cases to the Department of Health and the Department of Labor and Industry. Permanent standard is setting a floor, and if you want to go above and beyond that, you're welcome to do that. Again, we recommend that you be judicious in your announcements about positive cases in the workplace, because you want to make folks aware in certain cases that there has been a confirmed case, but you also need to protect the privacy of the employees who are implicated. And finally, as always, when in doubt, seek legal advice if you have questions. Many of you are going to be have dealt with a lot of these situations up to this point, and you are grizzled veterans. There are others that are dealing with some of these for the first time, and even if you've dealt with a lot of situations, these things take on they come in various in various shapes and sizes in terms of the issues that are presented, and there are a lot of times there are wrinkles that show up that you haven't had to deal with before. So again, when in doubt, seek legal advice. It can save you headaches down the road. So with that, we will turn things back over to April for any other questions that may exist.
Thank you. We do have a question that came in. If you report 3 positive cases using the VDH online reporting portal, will that satisfy reporting to both VDH and DOLE, or are there 2 different places that you need to report those cases to?
There are 2 different places. VDH might be contacting DOLE, but do not rely on that. You're going to want to have 2 separate communications, one to VDH and one to DOLE. DOLE's website is actually, for those of y'all that have not used the DOLE website, it's actually pretty good. A lot of people expect it to be bad. It's really not. It's pretty helpful. There's a lot of great guidance on there. We absolutely encourage you as employers, as HR individuals, to take advantage of the resources not only that Gen Edge has, but the DOLE has. It answers a lot of the questions. They've got a frequently asked questions, an FAQ. That is really good, because if you think your question's stupid, it's not. If you've got a question, you should probably, because there have been a lot of changes. There's a lot of new stuff that goes on, and DOLE is a great place to track all of that. But the simple answer is contact them both individually.
And I would just add to that, I think good advice typically, irrespective of the situation you're dealing with or the industry that you're in, what we would tell clients is it's good to have a good relationship with your regulator, and going that extra mile, making sure that you are getting the information required directly to DOLE, unless and until they tell you otherwise, is not going to be a bad thing, because it will help them to have record that you not only you're aware of the standard, you are complying with it, and that is a good thing.
I have another really great question that came in. When is an employer obligated to pay an employee for time away due to a COVID positive test or an employee that has symptoms? So there's an understanding that if an employee is told to get tested, that they're paid for that time. But what about, if they're if their test is positive and they're out of work for 2 weeks, or if it's an employee who's symptomatic but does not have a positive test?
So the short answer is that unless you are voluntarily complying with the extension of Families First coronavirus legislation, there is not an affirmative requirement for your business to pay folks during this time when they are out. A lot of employers are obviously are having their employees use accrued sick time, use other accrued leave as is their right to do so that folks are continuing to get paid. But many organizations are supplementing that if folks run out or they are doing something to try to lessen the blow, but there is not a requirement that you pay. And I'm sure Hunter will want to maybe jump in and just talk about some other considerations there.
Yeah, we handled this in the first part of this webinar series under the FFCRA. To make sure that you fully understand it, you should either refer back to our first webinar, which was last Tuesday, or just consult the FFCRA legislation, which beginning January 1 became optional for employers. Employers can still get the tax credits for opting in to the FFCRA through March 31 of 2021. And we don't know if that will be extended past March 31 or not, but currently it is, as Stephen already said, it's not mandatory. So you need to be consistent with how you apply. You can't say, well, we're going to give FFCRA to one employee, but not to another. And also, there's a lot more to this. So I really recommend you look back at the first webinar. If somebody's already used up their FFCRA allotment last year, you don't get a new allotment beginning January 1 under the FFCRA. That doesn't mean that you can't voluntarily pay your employees for being out for symptoms, even though they've already used up 80 hours from the previous allotment or from the allotment. I hope that answers the question. And sorry for taking so long.
No, that's okay. I have one other question at this point in time. If an employer opts to do testing and they test everybody and they test all of their employees first, can they then do a random testing of employees moving forward, or do they need to retest everybody if they do that?
Well, that's a good question. And this goes to the same answer that you would get with a drug screen, drug testing, random drug testing. You need to be able to show that it was administered on a truly random basis, such as computer generated picking of the people that are getting testing, or picking your names out of a hat. It's got to be random. It can't be systematic. It can't be targeted at a specific shift, the problem there is you're trying to avoid any sniff of discrimination on your testing standards. So if you're going with random, it better be random. And I just use quote marks for those who can't see me. We hear the term random that's far more often not random than is actually random. You need to know what the word random means. It's kind of like job related. If I use the term, I hope you understand, but random truly means you don't control it. Boy, that sounded harsh, but I just want to make sure that people don't fall into that trap of throwing it into the definition of random. But that's the answer. You can do it, but it's probably not a good idea unless it's truly random.
And then one last question I saw come through is, can employers require symptomatic employees to get tested?
Yes, you can require any of your employees to get tested. You need to make sure that the employee doesn't pay for the test. You need to be sure that you're paying them for the time that they get tested. But absolutely, you can require them to be tested. As long as it is job related and it's an accurate test for something which, like COVID, is a direct threat to the employment workforce.
Those are all the questions that I have. I'm not seeing any other questions come through the chat. So what I'd like to ask is for those attending, if you could take 30 seconds or so to complete the poll questions that have popped up on your screen, we would greatly appreciate that feedback. I'd like to give a round of applause and a thank you to Hunter and Stephen for their time and doing these webinars for us. They've been hugely informative, so thank you so much. Really appreciate that.
We really enjoyed it, and we appreciate the opportunity to share all this information with everybody. And please fill out that poll or answer the poll questions.
And as a reminder, we will send out a copy of this recording and the slides and this afternoon or early tomorrow. And thank you again so much for joining us today. And I hope that you have a great afternoon. Anything that I'm forgetting, Dean?
Not at all. I think I put up on the screen a couple of links. These will go out via the email as well. We do have a high-level online assessment that's up and running now. If you want to get started on looking at gap areas or potential areas that you might need to address in order to be compliant, we do have the next session of a workshop coming up through VMA for those who need some help training their folks on the new standard. And then there is a resource page where all of the previous webinars, all of the content that Hunter and Stephen have presented in the past is provided, as well as the OSHA webinar that we had earlier this week. So it's a great resource, and we're constantly updating it. So I would bookmark that and continue to go back to it as well. But other than that, I echo the thanks for Hunter and Stephen. Great job with the series, and it's been very informative. And hopefully everyone's gotten a lot of value out of that. You'll address the poll questions. We'd certainly appreciate it. Allow us to continue to make things better. And other than that, I don't really have anything else but to thank you for your time and hope that everybody makes good progress towards compliance.
And I would say, as a reminder, the workshop that's listed on March 9th is a partnership with the Virginia Manufacturing Association, and that will be something to help you with creating your infectious disease plan and understanding some of the risks in that. So that will be a workshop to help you meet some of the requirements and documents that have been talked about throughout this webinar series. And as Dean pointed out, that link is on the slide. And with that, I think we will conclude today's webinar, and thank you again, everybody.